Hello guys, welcome back to my YouTube channel. From this video, I am going to discuss about the anatomy of nasal cavity. So, as you already know, nasal cavity is located between the two orbits and the below middle part of anterior cranial fossa. It is divided into right and left halves by the medial nasal septum. If this septum is deviated to one side, the right and left halves are of unequal in size. Then if the nasal cavity opens into the face by two nostrils or anterior nasal apertures, and it opens in the nasopharynx by posterior nasal apertures. Each half of the nasal cavity has four walls, a floor and a roof, as well as lateral wall and a medial wall. The vertical medial wall, or we call it as septal wall, is the common for two nasal halves. So the subdivisions are: each half of the nasal cavity is divided into nasal vestibule and nasal cavity proper. So the first area about this area is the nasal vestibule, and this area is the nasal cavity proper. When we talk about the nasal vestibule, it forms the beginning of the nasal cavity and located anteriorly. Here this part is located anteriorly and bounded laterally by major alar cartilage. This is the lateral wall. Here you can see the lateral wall of the nasal cavity. So in this lateral wall, you can see alar cartilage. These are the alar cartilage. Medially by the septal process of major alar cartilage. Here you can see the bones of the medial wall of the nasal cavity. So this is the septal cartilage. You can see this part is the vestibule. So you can see medially in the nasal vestibule there is septal process of major alar cartilage. It is limited above and behind by the limen nasi, that means a curved ridge where the skin of the vestibule continues with the nasal mucosa of the lateral wall. This part is the nasal mucosa. Then the vestibule is lined with the skin and the sweat and sebaceous glands, and there are coarse hairs located which is called as vibrissae. When we talk about the nasal cavity proper, the nasal cavity proper is subdivided into functionally as the respiratory and olfactory. Nasal cavity proper subdivided into functionally as respiratory and olfactory. The respiratory area is large and it is covered by pseudostratified columnar ciliated epithelium. This part is for the respiratory function. So it is lined by the pseudostratified columnar ciliated epithelium and supported by adjacent lamina propria containing numerous nasal glands. Those nasal glands are the serous glands and mucus glands and the cavernous vesicular plexuses. This mucosa covers major part of the lateral wall, septum, roof and floor. The olfactory area, this part is the olfactory area. Here you can see the fimbriae of olfactory nerve, and it is located in the upper one third of the nasal cavity and covered by olfactory epithelium. When we talk about the functions of the nasal cavity, the vibrissae in the vestibule, that means hair, coarse hair in the vestibule, trap the foreign bodies in the inspired air. The respiratory mucosa is thick and spongy due to the presence of rich vascular plexuses. I'll show you later what are the vascular plexuses, and it is helps in warming and humidification of inspired air. The mucus secretion of the nasal glands trap dust particles, as you know, and the rhinitis is the word which called as the inflammation of the nasal mucosa, usually seen in common cold and hay fever. In rhinitis, the nasal mucosa becomes swollen due to rich vascularity, and there is increased secretion of mucus glands, resulting in chalked nose. So, in common cold or allergic rhinitis, there is increased in secretion of serous glands, causing watery discharge from nasal cavity. I think most of you watching this video have experience like that. And the when we talk about the olfactory mucosa, it is considerably thicker than the respiratory mucosa. Olfactory mucosa is considerably thicker than the respiratory mucosa, and it supplies an area covering the posterior or superior part of the lateral nasal wall, upper part of the nasal septum, and arching roof between septum and lateral wall. It is yellowish brown in color. It is characterized by bipolar olfactory receptor cells. Olfactory mucosa is characterized by bipolar olfactory receptor cells, and they are the first order neurons in the olfactory pathway. If you want more clarification about this olfactory pathway, you can watch my video regarding olfactory nerve pathway, the video series of cranial nerves. Let's discuss what are the communications of the nasal cavity. So, the nasal cavity communicates with paranasal air sinuses, and also in addition there are 6 communications with the nasal cavity. So, these are the 6 communications of nasal cavity. First, it communicates with the anterior cranial fossa via cribriform plate of the ethmoid bone. The cribriform plate carries olfactory nerves inside the cranium. Secondly, there are anterior ethmoidal nerves and vessels which communicates with the nasal cavity, and they are situated to cribriform plate. Then, thirdly, there is a foramen cecum between crista galli and the frontal bone, and this foramen gives passage to emissary vein which connects nasal veins with the superior sagittal veins. Then, fourthly, the sphenopalatine foramen in the lateral wall of the nasal cavity connects with the pterygopalatine fossa. The structures passing through this foramen are sphenopalatine artery, nasopalatine nerve, and superior nasal branches of sphenopalatine ganglion. Then, fifth one is the nasal cavity communicates with the oral cavity, and this communication is via the incisive canals in the incisive fossa of the hard palate, the nasal branches of greater palatine artery, and the palatine branches of nasopalatine nerve passes through these canals. Then the sixth one is nasal cavity communicates with the lacrimal sac via nasolacrimal duct through the and also through the conjunctival sac. Those are the 6 communications of the nasal cavity other than the paranasal sinuses. Next, we will see the boundaries of the nasal cavity proper. Nasal cavity proper presents floor, roof, lateral wall, medial wall, or a nasal septum. When we talk about the floor, it is formed by the mucosa covering the superior surface of the hard palate. You can see this part is the hard palate. So, the superior surface of the hard palate involving formation of the floor. Then the roof of the narrowest wall of the nasal, no, the roof is the narrowest wall of the nasal cavity, and it lies in the junction between lateral and medial walls. It has anterior sloping part and middle horizontal part and posterior sloping part. This part is the roof. So this is the anterior sloping part, posterior, the middle horizontal part, and the posterior sloping part. The anterior sloping part is formed by the nasal cartilages and nasal bones, as well as the nasal part of the frontal bone. These are involved in formation of and the sloping anterior sloping part of the roof. Then middle horizontal part is formed by cribriform plate of the ethmoid bone, this part. Then the posterior sloping part is formed by lower part of the sphenoid bone. This is the sphenoid bone. So this is the posterior part of posterior sloping part. Then the lateral wall of the nasal cavity is highly irregular and it is characterized by conchae or turbinates or metatarsus. Conchae are bony shelf-like elevations, and the metatarsus are the spaces between the conchae, and they increase the surface area of the nasal cavity. When we talk about the nasal conchae or the turbinates, they are inferomedial bony projections from the lateral wall of the nasal cavity, and there are three conchae: the superior concha, middle concha, and the inferior concha. Superior concha is the smallest and located in the posterior part of the nasal cavity, and it is a projection from the ethmoid bone. This is the superior concha. Then the middle concha is a projection from the ethmoid bone. You can see the green color ethmoid bone. And the inferior concha is an independent bone. This brownish color one is the inferior concha. Then nasal metatarsus. Those nasal metatarsus are the openings or the spaces enclosed by concha. There are three metatarsus: superior, middle, and inferior. In this picture, you can see the metatarsus very clearly. The inferior meatus lies between the nasal floor and the inferior concha. It runs along the entire length of the lateral wall and it receives opening of the nasolacrimal duct. And in its anterior part, the mucous membrane at this orifice is usually raised to form lacrimal fold, which act as a valve preventing air and nasal secretions being blown up into the duct. The inferior meatus provides an approach for draining out pus from the maxillary sinus as well. Then the middle meatus, it is the space between the middle concha and the inferior concha. This is the middle meatus. And it receives openings of four paranasal sinuses: middle ethmoidal, anterior ethmoidal, frontal, and maxillary. Here you can see the hiatus semilunaris, opening of maxillary sinus or in the floor of the hiatus semilunaris. And here this part is called as the hiatus semilunaris. And then you can see the small dots here. Those are the openings of middle ethmoidal cells. Then here you can see in this area the infundibulum, opening of frontonasal duct that drains the frontal, nasal, and anterior ethmoidal cells. There are several features of the middle meatus. The bulla ethmoidalis is a rounded bulge produced by middle ethmoidal sinus, which opens on or above it. This bulging is called as bulla ethmoidalis. Hiatus semilunaris is this part I told you earlier as well. Hiatus semilunaris is a curved cleft below and in front of the bulla ethmoidalis. Then the infundibulum here. The infundibulum is a duct-like passage beginning at the anterior end of the hiatus, and anterior ethmoidal sinus opens into it. Frontal sinus opens into the infundibulum by frontonasal duct. Opening of the maxillary air sinus lies below the bulla ethmoidalis. Then the superior meatus. That means it is present between superior concha and the middle concha. That means this area is the superior meatus. It is limited only by only the posterior third of the lateral wall. You can see also it is also situated somewhat posterior in the nasal cavity. Then the posterior ethmoidal sinuses opens into it. You can see the opening here, posterior ethmoidal sinuses. Let's discuss about the nasal septum. Nasal septum is partly bony and partly cartilaginous. This is the bones of the medial wall, that means the nasal septum. So you can see partly cartilaginous and partly bony. And the perpendicular plate of the ethmoid bone forms the posterior superior part of the septum. And the vomer, this one is the vomer, it forms posterior inferior part, and septal cartilage bridges the gap anteriorly. The other bones which make minor contributions to periphery of the septum are also you can see in this diagram. These are the minor bony projections. And the posterior free margin of the septum, here is the posterior free margin, is formed by the posterior nasal aperture or uh, choanae. Free margin of the septum can be inspected through nasopharynx by a procedure called posterior rhinoscopy. Skeletal nasal septum is covered with mucoperichondrium and mucoperiosteum except where it forms medial wall of the vestibule. This medial wall of the vestibule is covered only by skin. This part of the septum is mobile and it is called as columella. Let's discuss about the arterial supply of the nasal cavity. So the nasal cavity receives a rich arterial supply. This rich anastomosis is formed by the extranasal artery from anterior ethmoidal, and these are the anterior ethmoidal artery and vein. And then you have the posterior ethmoidal artery and vein. Then there is sphenopalatine artery and vein. Here also in the medial wall, you can see anterior ethmoidal artery and vein, then posterior ethmoidal artery and vein, sphenopalatine artery and vein. So those arteries, the anterior ethmoidal, posterior ethmoidal, and the sphenopalatine and greater palatine arteries make rich anastomosis in the nasal septum. The veins accompany the arteries and drains into superior ophthalmic vein, pterygoid venous plexus, and also the facial veins. Let's see the nerve supply of the nasal septum. From nasal septum, posterior 3/4 of the septum is supplied by nasopalatine or the sphenopalatine nerves. So you can see the nasopalatine nerve here. Then you can see the branches of the anterior ethmoidal nerve here. And here is the olfactory nerve. That means the first cranial nerve, septal branches of the olfactory nerve. So those are the nerves which supplies the medial nasal septum. And the lateral wall is supplied by, it is also supplied by this the olfactory nerves. And also there is anterior ethmoidal nerve. And you have the posterior superior lateral nasal nerves and posterior inferior lateral nasal nerves. And this is the nasal branch of anterior superior alveolar nerve, and this is the intranasal branch of infraorbital nerve. So those are the nerves which supplies the lateral wall of the nasal wall cavity. So that's all about the anatomy of nasal cavity and the boundaries of the nasal cavity. Hope you guys clearly understood about this anatomy and the blood supply, nerve supply as well. From next video, I will discuss about the paranasal sinuses. Thank you for watching.